Dr. Garrett, there's a lot of thought about ice, right? Like, oh, if I hurt myself, I got to ice right away. It's the best thing for me. And now we're learning there's other things that ice is good for, maybe things ice isn't as good for. What are your thoughts as kind of more of a rehab specialist at our office that you use ice for, recommend patients use ice for?
So ice is a bit of a hot topic right now in the rehab world. So we used to think that ice is just, ice is going to help me recover faster. I'm going to keep icing it. I'm going to keep icing it over and over, like weeks and weeks at a time, resting and icing. Yeah. So it turns out now we have a lot of data that shows that that's probably not necessarily the best thing to do.
Okay.
And so long story short is ice is probably best for some short-term pain modulation.
Oh, okay.
Right? You throw the ice on, it helps with the pain. That's super valuable.
Absolutely.
Okay. So the argument against ice beyond that is, when we actually have an injury, we want that inflammation to go into the tissues. That's kind of what's helping heal that injury. Inflammation gets a bad rap sometimes, and that's more systemic inflammation that we hear about, from things like autoimmune diseases or chronic diseases.
Gotcha.
That's the inflammation we don't like. Local acute inflammation is generally good and necessary for healing.
Okay.
So what happens when you ice is you're actually blocking some of that, those blood vessels. They'll constrict because they're cold. You're actually blocking some of that inflammation into the tissues, which can potentially delay healing a little bit if you're going like icing a ton over and over and over. But like we said, if you have an acute injury and it's really swollen, let's say you just sprained your ankle and you're in a lot of pain, throw some ice on. That's a great thing. It's going to help you feel better. It might calm down some of that like really, really intense inflammation that might not be super necessary. But beyond that, it seems like there's better things to do long term, and that's really just being active. Active recovery. So the old acronym was RICE, rest, ice, compression, elevation. But now one that I saw recently is ARITA, ARITA, which is active recovery is the answer.
Oh, I like that. Active recovery is the answer. Okay, I can remember that, Dr. Garrett.